Michelle Banger, Managing Editor of Quality. We're here at the Quality Show, the Assembly Show South, and Adhesives in Action. And I'm here today with our 2025 Quality Rookie of the Year, Atty Chakraborty. She's a quality engineer and in the digital healthcare division. So, Atty, welcome. Thank you for being here today.
Yeah, thank you so much. And before we start, just a disclaimer, all the opinions are mine and they do not reflect my company or any organization I'm part of. But yeah, thanks for having me, and I'm very honored to be nominated as the Rookie Award winner this year.
Yeah, congratulations. You're well deserved. So I know you've done a lot of different work in the medical space regarding AI. Could you tell us a little bit about your medical AI experience?
Yeah, so what I basically work on is on the regulatory and the quality side of things when it comes to AI-enabled medical devices. And most of this work is basically kind of research-based. It's with groups which are like focus groups and associations which are kind of like industry groups. So that's where I actually met many of my collaborators, and I ended up publishing some research with them on in 2024 about the general AI regulations for medical device. Because at that point there was a lot of discussion about regulations in general, but it didn't really talk about specifically about the medical device part. So it kind of started with that, like just doing a kind of understanding of how different countries are regulating it, what aspects are they focusing on, what are their points of convergence and divergence, and so on. But then as the new year rolled in, we started noticing that, regulation is, it has come a long way when it comes to AI, but the next question is how do we implement it, or how do we actually incorporate it in a product development lifecycle. So that's what I've been focusing more on this year, and we are scheduled to publish a paper on that also very soon. Me and my collaborator Mandar Karhade. And I think that's the gist of my involvement with AI outside, in my own time. So
great.
Yeah.
I know you've presented on this topic at a few different events. Could you tell us what kind of the takeaways were from those sessions?
Yeah. So when it comes to the general regulatory landscape, a lot of things actually came up. We noticed that most of the focus was actually around the US and the EU, but there was less focus around emerging economies and how they're doing it. So we were actually pretty surprised ourselves to find that many emerging economies, like even in Saudi Arabia, where they actually specifically talk about positive predictive values and other kind of metrics like that, which we thought was a big thing. The main concepts were similar around WHO's main principles, like documentation, transparency, explainability, and all of that. But one major kind of gap we found was the intended use in the clinical aspect of AI, which I think still remains a very hot topic in how do we clinically validate AI systems and things like that. So with respect to that, the FDA actually has a new draft guidance which was launched early this year in January, where they talked about how you can use human factors engineering for medical devices when it comes to AI, how do users actually interact with it. Users also include clinicians in this space as well. So that's a major concept, and in the last year, a lot of progress around standards which have come up, AMI 34971, which talks of the application of risk management standards, 14971, in the context of AI. So there's a lot of development on that front as well, and now the more people are asking that can I have kind of checklists to establish that whether I've met all the requirements while designing a product. When do we actually think about planning? What kind of metrics do we use? And things like that. So it's really evolved over a course of time, from starting about what do I regulate or what's under the scope, to actually what metrics do I use to even ensure that my validation has been successful or not. So it's been a very quick turnaround, I would say, given the medical device industry so far. So it's heartening to know, but of course there are still some gaps left, which I think as an industry we will be able to figure out as we proceed.
Mm-hmm. For sure. So after these sessions, are there any common questions you hear from the audience, things they want to know more about?
Yeah, I think the checklist part is something which they always ask about. They know what kind of metrics can be used. So for that, like even the FDA draft guidance, it talks of like scores, like the F1 scores or area under the curve, which are like specific metrics that you would use for like if you have imbalanced data sets and things like that. So they do give some examples of what kind of metrics to use. And in fact, back in 2022, there was actually a focus group from the UN called the AI for Health, and they published like a 140-page checklist of like different kinds of requirements and different kinds of objective evidence that you would want to have for meeting those requirements when it comes to an AI-enabled medical device. So far, I think it's still the best resource, even though it's been 3 years since they published it. And I think that's usually the main thing that I point them to. And also more understanding of like case studies of like, you know, what kind of, like how exactly does it incorporate into a workflow, or like what would be your inputs, what would be your outputs, things like that. Mm-hmm.
Yeah, speaking of case studies, do you have like an example you could share about an AI medical case?
Yeah, so most of the devices which are cleared or approved by the FDA, they are locked algorithms. So in the sense that they don't continuously learn. So that's one major point. Most, if you do a trend analysis of the way clearances have gone so far, most of them are like radiology, like overwhelmingly, I think more than 95% at this point. So mostly image scanning kind of based models, those are like most commonly used, and I've seen many companies across use that radiology as like their starting point. And that's like one major kind of thing. But then if you look at the FDA database, you'll see a number of products which are already out there which have AI in them, either whether it be like not just image scanning, but also in predictive analysis, also in even like, you know, algorithms which determine or predict certain clinical conditions, like physiological conditions as well. So there's a lot of different examples from there, and overwhelmingly most of them are from the US, but you'll see some examples even from India, even from Canada, which have been using AI in or as a medical device. Mm-hmm. So yeah.
Yeah, wow. You talked a little bit about this before, but how has the trend in using AI changed just in the kind of short time it's been implemented?
Yeah, so I think like what most people are looking for is when it comes to predictive analysis, how can they use AI? That's what I have seen in the industry so far. And mostly it's about like whether they can reduce the clinical burden when it comes to a physician's daily life. So it's mostly, they've also been using AI for EHR as well, or like even for reducing administrative burden, like, you know, taking doctors' notes and things like that. Gen AI has been really on the rise for especially making kind of notes for doctors, or like even something that a doctor or physician can interact with when it comes to making a decision or making a diagnosis or prognosis. So those are like mostly the things that are up and coming and which have already been there. But yeah, I think that's like to your question, that what are the major trends, those are like the major applications that we see it in. Mm-hmm. And yeah.
And how about challenges? Are there certain things that have come up that seem to be kind of roadblocks along the way?
Yeah, I think the question, again, like this is based on my interaction with the people I have met in the industry. It's the same concept of like the intended use and the clinical validation part. Like, how do you even know that it's working as intended, or how do you ensure that your particular product meets that intended use, and that intended use does not increase its scope over time? So like in the sense of scope creep, where you initially think that my model will predict, let's say, pancreatic cancer in this particular population. How do you ensure that after you're done with everything, it still predicts the same thing in that particular spectrum of the demography? So that's like the major question that has come up. And the other part is, what is the golden standard when it comes to validation? Like, what is the gold standard or the reference point that you use to test that whether your particular model is actually working as well as a clinician actually does? Even in that, there's so much variation. Like, let's say you do a survey and collect a number of physicians from, like, who are, let's say, specialists in pancreatic cancer determination. And the way you select your physicians as well would actually be kind of random. Everyone would select those physicians in a different order or from a different place, and your gold standard would kind of change. So how do you ensure that that gold standard stays the same across the industry? Because mostly people say clinician interpretation is the gold standard. So again, it all depends on which clinicians you choose. So that's like the major problems that I have been seeing. Most of the questions that have been asked to me as well, and I think that's like the major hurdle.
Mm-hmm. Yeah, that makes sense. And do you think that people are adopting AI as fast as they should, or does it seem like there's more room for growth? Or
yeah, I think like the discussion has turned more towards user training in a strange way. It's not just about ensuring that your model is working as intended, but it's also like how your end user is actually using it correctly or not. So the FDA actually like wants demonstrations of your product. In their draft guidance, they have mentioned all of this, and even like, where does AI integrate in your life cycle in the product? How does the user interact with them? Are there any features which you can toggle and switch off or switch on? This is like very important when it comes to alert thresholds. Imagine like if your system should give an alert if something goes wrong, but as a user I can mess around with it and be like, oh, I don't want this feature. So then that would make it very risky, and the risk aspect is like the major part. And like across all the countries, that's like the major issue that we're seeing, that the risk management part of it, that is one of the most important aspects, and people are like really getting to that. So
yeah, I was going to say, it seems like risk is kind of the main thing in the background, like what's the value and what's the risk on the other hand.
Yeah.
So it makes sense. Okay, so I think those were kind of the main questions I had for you about it, but is there anything else you want to mention on the topic?
I think like it's, as I said, it's a very emerging field, and it's a very exciting time, to be honest. There's a lot of hype around it because it's like everyone wants to use AI, but then how do you actually use it in your product? That's another big thing. When it comes to investment in AI, like again, this is general company trends which I have seen in the industry. It's all about like what is your actual benefit coming out from it, and if you already have certain things in place which kind of do the same thing, but AI is just a cosmetic feature, then well, like many companies are backing out of it. But then in certain cases where it's like something which is core to the product, then it's like, yeah, it's something that we want to use. But that's what I've seen like in the trends of device approvals, like which are publicly available. It's more like they focus, like they use AI for predictive diagnosis. That's their main, like their main kind of selling point. So yeah, I think, and the other part is the risk management part, the user training part of it as well. Like it's going to be interesting because AI is also being used for training. Like there's so many vendors out there who talk about like using AI for training personnel as well. So for like kind of like showing a clinician how to use a device, maybe you can use AI in that as well. So it's like kind of a mixed bag situation where you have AI in the product as well as facilitating people to use it using training which has AI or VR or AR or something along those lines. So and then there's AI in manufacturing and all of that as well. So that's like a whole new concept. But yeah, overall I think it's an exciting time to be in. But when it comes to the actual value proposition or like how much value is created out of it, I think that's where different companies are differing based on like the industry trends so far.
Yeah.
So, yeah.
It makes me think like where do you think it'll be in 5 years, 10 years? Do you think it'll be really totally different by then? Or
in my opinion, I honestly do not think so. The reason is that even though people say that, okay, like, it can automate so many things, but like when it comes to like validation and things like that, humans still have to be in the loop. And human in the loop is like a concept which is advocated by almost every industry group out there. So it's gonna be hard to fully rely on it completely until like you have the validation and everything done in the right way, and audits as well. That's a huge part of it when it comes to using AI in a regulated industry, whichever industry you talk about. So I think in 5 to 10 years, the philosophy behind quality management principles still remains the same. Like we still have these concepts of like, auditing, of like validation, of like testing, of risk management. We had all of this. It's just that we're using it to a new technology and we're thinking about it in a different way. So we're probably having different metrics for it and different ways to ensure that the right people are actually working on the product. I can give you an example of this, like where AMI 34971 actually talks about the people who should work on the risk management aspect for an AI product, and it says that people who are like trained in machine learning or things like that. So basically, it means that someone who really knows the technical aspect should be working on it when it comes to risk assessment and things like that. And that's something which has already been there. So, and I've seen so many other standards which are just up-revving themselves, having an additional section on AI. But again, the core philosophy remains the same. So I feel that like design controls, all of that, it still applies. So it's just a different way that we have to navigate it.
that makes sense. All those quality principles are evergreen and have been around for 100 years or something.
Yeah.
But you're right, new technology and new ways to adapt. So that sounds good. Okay, well, I think that's all the time we have, but thank you for listening. And for more information, you can always visit qualitymag.com.